Dr. Clayton, thank you so much for joining us. I know your office is swamped, so we'll keep this brief, but first, can you give us an update on the coronavirus in South Dakota?
Certainly. So we have 11 cases currently in South Dakota. Unfortunately, we have had one individual who has died from coronavirus infection. We have tested over 500 individuals, and we continue to offer testing at the State Public Health Laboratory, mainly for those who are individuals who are hospitalized, those who are healthcare workers, and others that might be living in institutional settings, such as long-term care facilities and assisted living centers that are at greater risk.
So you mentioned that you have tested about 500 people. Is that correct? Now then, I understand earlier this week, then testing kits ran out. What is the current situation on that?
So we do have some additional kits that have been received at this point. So we are up and running with some additional testing. We have always had a prioritization schema on our website, which is focused on individuals who are at higher risk of either serious infection or of potentially transmitting COVID-19 infections to patients. And so we have been able to resume testing for those higher risk individuals in those high risk populations.
Can you tell us a little bit about who is then higher risk and what some of those diseases are?
Certainly. So the information that we have is coming out of China and some of the earlier cases that we do have in the United States. So those individuals are older Americans, so 65 years of age and older, individuals with pre-existing medical conditions, and that primarily focuses on those with lung disease, heart disease, diabetes, and immune suppression.
You mentioned that you got more kits in. How many is more kits? Were we talking hundreds or thousands, or how does that work?
Yeah, so we have the kits in stock so to be able to test a large number of people into the hundreds and even into the thousands. Really what we're experiencing right now is the key chemicals and key reagents in order to perform the testing. There is a nationwide shortage, and so we have been working with the White House, the CDC, and others to be able to receive those kits in, or those reagents in order for us to be able to complete the testing.
Is there any suspicion of community spread in the area?
So of all of our 11 cases, what we do know is that all of those individuals did have a travel history outside South Dakota during their 14-day incubation period for the virus. So that would have been the time from when they were first potentially infected to when they started to show symptoms. And so for those individuals, we can say that travel was likely a contributor to their infection. At this time, we have not identified a person to have been infected who has not had a travel history. We are on the lookout for that. That is a key component to our investigation. And so we continue to ask any patient who does test positive for COVID-19 about their history in the past 14 days to help guide whether or not we do have community transmission.
Can you tell us if this was mainly air travel, and if so, was it domestic or international?
It's a little bit of both. We do have individuals who had traveled to Europe prior to the travel notice coming from CDC that there had been a larger widespread community transmission in Europe, as well as we have some individuals who had traveled in the United States. And so we don't know exactly the focus of their, or the source of their infection, whether that was acquired locally in the places that they have visited, or if they have may have come into close contact with someone during their travel.
Okay. Is there a suspicion that the load is actually higher than can be documented right now?
I think one of the key messages coming from the Centers disease control and prevention is that, we anticipate that there are some cases that are have much milder symptoms than the individuals that we have tested, and so that our number of cases that we have identified is likely an underrepresentation of the true burden within some of our communities. But there again, South Dakota is one of the states that has had a much wider sort of focus on identification of COVID-19 infections based on the clinical criterion that we had set forth and that providers in the community were using. And so I feel that we have been able to identify a large number of those individuals. At least there was the opportunity for us to do so. But it is important that testing is transitioning, that we know that 80% of individuals who become infected with COVID-19 will not have a severe infection. They'll have mild upper respiratory, moderate. So, potentially a fever, cough, maybe a little bit of shortness of breath, and some other symptoms that we typically see with respiratory disease.
So speaking of that, typically we show flu numbers, and that has been the biggest concern that we've had over this season. And we still have, the flu cases in South Dakota were over 14,000 so far this season, is that right? So how much of a risk is flu still, and how does the flu in severity compare with COVID-19?
So influenza still is a risk in the community. This is still the time of year when we have reached our peak for influenza activity. So we are seeing decreased activity overall. But the influenza and other respiratory pathogens typically circulate this time of year. So it is important that clinicians are concerned and first identifying influenza in patients that they suspect may have COVID-19 infection. It is important both for the clinical identification of those cases, as well as just to note that individuals do die from influenza each year. Our COVID-19 case fatality rate is about 10 times higher than it is for our seasonal influenza. So it is something to keep in mind as we have individuals who are either severely ill due to influenza or becoming severely ill due to COVID-19. That we do anticipate that we will have additional cases in South Dakota, we'll have additional hospitalizations, and unfortunately we will have additional deaths.
What would be your bottom line message for our audience tonight?
I think the big question is focused on prevention and looking at that from an individual perspective. We want individuals to stay safe. For your general precautions are making sure that you're washing your hands frequently. That means with soap and water. It may also mean with alcohol-based hand gel or alcohol hand sanitizer. When you have been out in the community or before you touch your eyes, nose, or mouth, so that means before you eat, after you blow your nose, and things like that. The other thing to do is if you do develop symptoms, and this is just the generalized symptoms of fever, cough, or shortness of breath, that individuals should take personal responsibility and stay at home. The focus here is that it might be influenza, it may even be COVID-19 infection, and that those individuals can avoid spreading either of those pathogens by just staying at home. The focus is if you're concerned that you might be infected with COVID-19, staying at home unless your symptoms become severe, and then in that case call your doctor. And if they don't become severe, staying at home for 7 days as a minimum, and then you might need to stay for an additional few days depending on when your fever breaks.
Good advice. And if they do, and they shouldn't just show up at a clinic or a hospital, is that correct? They should notify them in advance if they are concerned they might have COVID-19?
That's a very good point. We are focusing at this point on telehealth, and so that's something as simple as picking up the phone and calling your doctor's office before you would arrive. That way they know you're coming, and if you need to be evaluated for COVID-19, that they're taking the proper precautions. And we want to keep individuals healthy. We want to keep our healthcare providers healthy as well.
Great. Thank you very much, Dr. Clayton.
Thank you so much.